Well, let's go ahead and get started. It's a small, but it's a beginning for us. We've never done this before in the office, but I thought it's an appropriate time because people with medical backgrounds should be confused about the information that's being liberally spread around by varieties of sources who have obviously different agendas. And it's our role as your family's pediatrician to protect your children and to be sure that you get the best and most reliable scientific information. Those of you who've been in the practice and seen me over the years have to know that I'm a very conservative pediatrician, and that means simply that I take the least risk that I possibly can with your children. And my advice to your children: we don't treat people over the telephone for anything other than simple advice. Children are very precious to us, and we'd like you to have the best information so you can be guided. I don't want to get into the politics of things, and it's disappointing to me that they are influencing what should be public media, but I decided that it would be important, I hope, for me to say what I have been able to glean both from what the news media has as well as the hundreds and hundreds of studies that are being sent to me daily. Y'all probably know this, but in Fairfax County, there have been 317 deaths in Fairfax of 2,500 people who have been hospitalized. That means that if you get sick enough with this disease, that you're very likely to get hospitalized. And if you get hospitalized, you have a 10% chance of dying. Now, that's a little bit older information because I'm going to talk about it later. The two treatments that have just been revealed that may change that particular curve. Fairfax Hospital has tested, or the Inova system, excuse me, has tested 39,000 people in Northern Virginia. Obviously, many of them had reasons to be tested, but certainly amongst those people, there are a lot of people who went to get tested just because they wanted to be tested. And what the data shows is that 8,500, or approximately 25% of the people that look at the Inova Health System as their source of care, are carriers or who are positive for the tests that have been done. The estimate, and this is just your general estimate, is that about 17% of people in major metropolitan areas are positive and may be carriers and are not sick. They may be on their way to getting sick, but when they were tested and screened, they weren't sick. That literally means, as you know, that 1 in every 17 people, there are not 17 people on this chat, but likely you're going to run into your daily life as the community opens up. People who you know, people who you talk to are COVID positive and don't know it, and unquestionably have the ability to spread it. There was a discussion that went on for a long time that if you were asymptomatic, you couldn't spread it. And the most recent study that I was able to read shows that 40% of the people who are asymptomatic have the ability to spread it. We don't know who those 40% are, so certainly anybody who's positive can, at least for up to 14 days after that information's known, spread it to other people. The other thing that I think we have to consider, particularly in Northern Virginia, is that this is an area where many people travel to and through, so that on any given day, there are people coming in and out of the area that have been in areas where there's a much higher rate of COVID positivity, so they may bring it with them into the area. And as I'm sure you've learned, we really don't know very much about people until they've been contacted, infected by somebody, and don't show up to be sick for 2 to 3 weeks afterwards. So during that period of time where they're in contact with you, they can transmit it to you and subsequently be sick. You won't be sick for 2 to 3 weeks if you're going to be one of those people that get sick. A positive to the statistics is that there are very few children across the country who have died, but there are numerous children who have shown up with this inflammatory syndrome, which means for them they may end up with heart disease. There have been no deaths in children in Fairfax, but that certainly doesn't mean that there won't be. And just as a reminder to what the risk is, and again, I point out I'm particularly conservative, is that New York must have been contaminated for weeks and months with hundreds of thousands of people before people started to get sick, because they had so much disease all at one time and nobody had any idea about it. My personal advice is that you should listen to the scientists. There's a Dr. Osterholm up in Wisconsin, Dr. Fauci, many of you have heard of, who's at NIH. He now seems to be operating professionally independent of political influences. Dr. Hotez, I'm sure you're familiar with Governor Cuomo and what he's done in New York. He seems to be reliable. And Dr. Gupta, who's a neurosurgeon but is a spokesperson on CNN, all seem to be echoing stuff that the medical community is sending to me to read every day as reliable evidence-based medicine. Evidence-based medicine generally means that a study has been done that meets the scientific criteria of legitimacy, and the results are statistically significant. In medicine, and most of you probably don't have a background in medicine, everything we do that's scientifically based, evidence-based, is based on a percentage. That is, it's 90% likely that your child has this. If we have a lab test and the throat culture is positive, it gets closer to 100%. But many of you know that kids carry strep and have other illnesses, and if we do a throat culture, we're going to pick up strep. So it takes a clinical judgment. Unfortunately, in this situation, in every medical situation, even though it might be 95%, for an individual patient, they either do or they don't have it. So they have 0% if they don't have it, and if they have 100, if they have it, they have 100%. And the issue that concerns me is that if any of our patients get sick with this, and we've had 5, one who ended up in the hospital and fortunately didn't die, but that child is 100% sick, and quite frankly, it doesn't really matter to you or that child or other people who are not sick, that they're not sick. You've got to deal with your child and that child having a disease that you then is likely to spread to you. You may not get very sick, or you may get asymptomatic, but then you continue to spread it to other people who you have contact with. So I don't think of, in the way I practice medicine, think of, well, only a small percent of our kids are going to get sick. Even if one gets sick, that's terribly important to me, to Dr. Reese, There are nurse practitioners, and it's very important that we take care of that child right. Another area of confusion is testing, and we will soon have testing in the office. We have struggled, and despite whatever the media says, there is no easy testing available. Most of the testing sites require a note from a physician, are supposed to be following the CDC guidelines with it. Those tests are generally the PCR testing that takes 5 or 6 days to get back the answer. And when you get it back, although it's reliable, it was only reliable for the day and the time that you were tested. So you've got an answer 6 days later. The test we'll have in the office is the first one available. By the way, we've had 5 tests a week is all they've allowed us from the laboratory. It will be the rapid test, the one the president touted. It's not Abbott's test, but it's another one. But it's only 80% sensitive, which means it's going to be wrong 20% of the time. That's not a reliable test. We will have it, and we will use it appropriately for families or for children who have symptoms compatible with it, or people who have been exposed to COVID. But again, it's not a very good test in terms of its reliability. The strep test we do in the office is almost 100%. By comparison, the flu test is up to 93%. This at best has 80%, and some studies have reported that this test may only be 50% accurate. It's a 15 or 20-minute test. It'll be covered by insurance, but we will use it somewhat sparingly. We can't turn the office into a testing center except for our own patients, and we'll follow the CDC guidelines, and that again will usually be for kids who are sick and we don't know what they have, and or for people who are known contacts. But as you probably know, the CDC says that if you're a known contact, whether you're positive or negative, you should self-isolate for 14 days, and your family should self-isolate. There's also antibody testing, antibody meaning a blood test, which will determine or should determine whether or not you've actually been infected. That doesn't mean you've been sick, but you've had the COVID virus sometime in the past. The difficulty with that is that there are 80 unregulated and unapproved tests. Nobody knows which ones are reliable. And what we don't know when we're measuring antibody, whether the antibody is one effective in protecting anybody, and if it is and turns out to be, how long it'll last. It's just too soon. So doing an antibody test, except in a study, is not giving the reassurance that we normally can get from antibody testing. That obviously is going to be worked out. The good news that you probably know about is that there's now some treatment, and very interestingly, it only seems to work in the sickest people, which made me think that there's something about what this disease does to those people who get on ventilators is somewhat different or at a different stage. The medicine that most people know about is Decadron. It's a cortisone. We've used it, and it's relative drugs to treat asthma for years. It's extraordinarily safe. It's got to be given IV, and it's done for people on ventilators. Again, the people who weren't sick enough to get on the ventilators didn't have a different course. They weren't out. The other drug is remdesivir, which is an antiviral. Again, it only works for people who are hospitalized and ventilator necessity sick sort of stuff, but at least we've got something for those people who are going to get that sick. And we have no way, by the way, of predicting that, except that, again, statistically, it's not likely to be a child. No child, as I said, has died at Fairfax, but there have been multiple admissions and some kids on ventilators. I wanted to speak a bit about our office because there are a couple things that are really important. We actually rebuilt the interior of the office so that any sick child now can enter the office and be assured of not spending any time or even seeing any other child. And we have a separate entrance and exit, and the office is walled off. There's a bathroom and there's door access from the inside for the nurses and for us to come in and see. Everybody is waiting, as they are in most places, in our parking lot and communicating with us by phone. That's working fairly efficient. It's taking, in general, about an hour to an hour and a half for people to get in and out. That's not much more time than usual in the past. So please feel free to come to the office, feel safe when you're in the office. We've been very fortunate. We were able to get full protective equipment when this whole thing started before it dried up. And so all of our staff have the N95 masks and face shields and gowns and gloves, and we sterilize or sanitize every room in between patients, and we can deal with any kind of special circumstance, I think. I want to mention, and please spread the word because there's not a lot of people on here, that we have food available for people, or we can give people access to food. If you know anybody who has a particular need, particularly people who have lost their jobs, even if they're not our patients, just have them get in touch with the office and we'll put them in touch with people that'll give them food. And if anybody's lost their health insurance, we've been through this before and we have several options. We want families to not deny their kids care because of money. We'll work out whatever it takes to see any child as well. We're very much aware, even though everybody is focused on COVID, that there are all these other illnesses. And fortunately, with school out, the ear infections and the pneumonias and the strep throats have died down tremendously. But if your child is sick or has an injury or has a rash, please come in and let us see them. We tried doing stuff with telemedicine, and we can do kind of the subjective advice and psychiatric stuff, but the video quality is not good enough even to identify acne in a teenager. And so trying to practice without making errors is extremely dangerous and difficult. And so we really think it's in people's best interest to come in, and we think we've got you protected. The other thing that's happening nationally, and it's certainly happening in Fairfax, is that people are not coming in to get their kids their usual immunizations. And so many of the infectious disease experts are beginning to wonder if we're not going to see the reemergence of measles again, of meningitis, pneumonia illnesses, because kids aren't coming into medical care all over the country. And that's different from the people who don't want their kids vaccinated, which I want to make a pitch here for vaccines, but particularly the COVID vaccine, which is coming out. That's the only answer anybody can come up with unless we get some treatment that's going to end this disease. So when this vaccine comes out, please give serious consideration to giving it. We're going to participate in some studies. We've been asked by Pfizer to recruit patients. The study's not started yet, but there will be vaccines, I'm sure, but when and how they get distributed, I don't know. I started my conversation with a discussion about confusion, and our primary goal is to protect you guys. And I just want to emphasize that a mask is an absolute necessity to give you the best protection. And everybody, every time they step out of the house, ought to have their face covered. I'm a bit disturbed because everybody's being told, and it's only because they're not available, to use a cloth mask. The medical community, when we can get it, are using something called N95 mask, which not only protect the person you're next to, but also protect the person who's wearing the mask. There's really a 20% difference in the effectiveness of these N95 masks. So that's 1 in 5 people could avoid some consequences. And I'm telling you about it for 2 reasons. One is I'm going to tell you how to get one. And 2, I'm going to tell you a way to make what you've got more effective. If you go online, there is a website called, I think this is correct, or you Google it, Fix My Mask. But what it is an ingenious way to use 3 rubber bands hooked together to seal a cloth mask around your nose and mouth almost as effectively as an N95 mask. And it's very simple. You just put 3 rubber bands together, put 1 in the middle around your nose and chin and the other 2 around your ears, and you've almost got an N95 mask, according to the studies. The masks that are out there that are white foldable masks that fold down like a white handkerchief, many are counterfeit. And they're sold and stamped N95 or KN95. There's a way to check them to find out if, in fact, they are reliable N95 protection. And if you put one on and try to blow through it, you can't make a candle flame move at 6 inches. Just means that it's not letting stuff get out of the mask. Secondly, it will hold water. So if you put water in it, the water doesn't make it wet or drip through. And thirdly, and I can't do this because I don't smell, you apparently can't smell sweet and low, which is saccharin, through it. So if it meets those 3 criteria, it probably is a legitimate N95 mask as well. The mask I'm going to recommend, and it's because I know it's available, I talked to the manufacturers today, is this plastic mask. Cost about $13, $14. And we'll send this out in a blast. I think I'm running out of time, so we'll send it out to you. It has a reusable, here it is, filter piece in it. And what essentially is in here is heating and air conditioned filter paper. It's called melt blown filter media, and it comes in various strengths, but it's MERV 15, and you can literally replace it. This just slips in the back of the mask. You can see it there. This fits so tightly that air doesn't come in. When you put it on, and again, it doesn't have ear loops. It has elastic straps that go over the back of your neck. Anytime you breathe in, the mask caves in a little bit, which means it's totally sealed around your face, and that's called the fit test for the N95 mask. And these filters that I told you about, the air-conditioned filters, the MERV 13 are equivalent to, and you can buy one off any shelf, or you can buy a roll of the material in Walmart, is equivalent to a medical mask. So you can get that. The company that sells it, and we'll send this out in a blast email tomorrow, is called Rapid Made Incorporated in Oregon. So you'll be able to find them, and they will sell you one to however many masks you want. They're not FDA approved because they haven't gone through that process, but the filtering capability, particularly with 2 or 3 layers of the glass melt MERV 13, far exceeds N95. You can get up to N100 with that. So my recommendation is to go and get some mask or modify your own mask to doing that. The other issue is social distancing. The data that was originally available and it's still being promoted is 6 feet. There's no reality to that. It all depends on the force of who's coughing, the wind currents in the house or in the environment you're in, and the latest studies that have been done with more recent scientific strategies says 12 feet is a much better number to use for distancing. So please do that. Please use sanitizer. Wash your hands several times a day. Please be sure your kids get their immunizations, and will be available. And as I mentioned at the first of the meeting, if there's any personal thing that you want to talk, please call up and make a televisit stuff so we don't violate your personal stuff. The last thing I want to talk about is school. I don't think anybody knows what to do. Kids need to be in school. On the other hand, there's a risk. And I would just say, let's wait a couple months and see what happens and what the options are. But kids can get sick, kids have died, and kids can certainly spread it to you, and you can spread it to other people who are much more at risk. But everybody really is at risk, some more than others. I just think you have to be as careful as you can, and nothing's more important than your health as far as I'm concerned. And I understand people need to go to work and kids need to go to school and everything else, but you just don't have to take chances that you don't have to take. This will get over sometime. We'll have a vaccine certainly in a year, I'm reasonably sure, and that'll make a big difference to this. Many states who've opened up are now, just as expected and predicted, rising in their incidences, rising in their hospitalizations. Those people are traveling around, doing whatever they do, and many of them will be in Northern Virginia. Likely we'll still have to deal with ups and downs. But again, 25% of people tested at Fairfax in the ANOVA system are positive. So you don't have to go outside of your house to find somebody. It won't be very difficult to find somebody. So that's about all I have to say. Again, I thank you for joining. We're going to tape this, and I think Sarah will probably send a link out to everybody about it. And if you enjoyed this and you have other subjects you'd like us to do this with, now that we have this technology, if you'd send them in to us at the office and call, we'll try to put together another one. And as we get closer to school, I'll certainly come out again. And those people who want to hear our thoughts scientifically about what's going on, we'll try to put something together so you'll have the latest scientific information to make your decisions about school. And again, apologies for no questions, but HIPAA rules and HIPAA laws actually probably make it best that we don't have two-way personal conversations. Thank you and have a good night. Please stay well. Please protect yourself and your kids. Get masks. I know you know how to get them now, and we'll be available. And again, call us for any questions. Thank you. I'm going to sign off. Sarah, is that okay?
Yep.
Okay. Bye-bye, everybody, and thank you for joining us. Thank you, Mr. Torres.